Afternoon, everyone. This is Tanya Haas. I am the in-house health and wellness writer here at Medcan. Thank you very much for joining us today for this month's seminar, Naturopathic Approaches to Combat Inflammation, with Dr. Benjamin Klinck, the Director of Naturopathy at Medcan. Now, before I introduce Dr. Klinck, there are a few housekeeping items to cover. This presentation is being recorded and will be made available at medcan.com under Medcan Insights in a week or so. There is the option to join us only by audio if you're in your car or commuting, and to do that, the phone number is in the registration and reminder emails that you've received. And regarding the audio, due to the volume of participants we have online and on the phone today, we will be muting all incoming audio to ensure clarity. That being said, if you do have questions throughout the presentation, you can ask a question on the slide on your screen. So there is a little box there that says question, and throughout the presentation feel free to ask a question, and at the end of the presentation Dr. Klinck and I will go through the questions, and we have scheduled time to answer a few of those. So feel free to ask questions along the way, and they will be reviewed, and we will try to get to as many as possible. And finally, please remember that the information in this online seminar is for educational and information purposes only, and is neither intended to be relied upon nor to be a substitute for professional medical advice, diagnosis, or treatment, and we do recommend you see a naturopath if you do have any specific questions. Now, with all that being said, I have the great privilege to introduce my colleague and presenter today, Dr. Benjamin Klinck. Now, Ben is the Director of Naturopathy. He developed and implemented the program here at Medcan in 2012. He is a graduate of the Canadian College of Naturopathic Medicine, and he finished an externship at Johns Hopkins University at the Integrative Medicine and Digestive Center. He also has worked at the Queen West Community Health Center and Sherburne Health Center, and he is also has been a lecturer and teacher at different institutions, including Ryerson University. Now, in addition to being an advocate for integrative medicine, he also has special interests in preventative medicine, chronic disease, and cardiovascular health. So without further ado, I pass the microphone over to Ben.
Thank you very much for that great introduction, Tanya, and thanks for joining us for this lecture today. We do want to address just a brief overview on inflammation and stress. We want to cover off the effects of health, and I would like to give some suggestions from my naturopathic lens that can give you some ideas of how to improve some common inflammatory conditions.
Yeah, so we had a lot of people interested in today's seminar. I think a lot of them are asking, inflammation is in a lot of headlines, and why is it relevant? Like, why are we supposed to care about inflammation?
Definitely. And I mean, you touched on a great point. Tanya, I find that it's something that I'm talking about with just about every patient that I have here at Medcan. And inflammation seems to be right now really right in the crosshairs of modern medical approaches. So they're really looking to see how we can counter the effects of chronic stress that seems to be plaguing our North American lifestyle. And these effects tend to spill over and affect our body in many different ways, and they ultimately do drive inflammation. So getting tips and tricks, ideas to be able to reduce inflammation is going to improve your health today, but also prevent things in the future.
Yeah, I've been hearing a lot about like low-level chronic inflammation. So yeah, it'd be great to know the difference between acute and chronic, which I think you're talking about right now.
Yeah. So certainly, acute and chronic inflammation. Acute is what's happening when your body has to fight off a foreign invader, like if you have cold or a flu. An acute inflammatory reaction may occur to some type of irritant that maybe you're allergic to. And acute inflammation is occurring when you get a bump or a bruise or a cut, that whole repair process of damaged tissue as well. Now, when I'm talking, and what we'll be referring to for the most part is chronic inflammation. So that's more of an ongoing, continuous inflammation that can occur, and that inflammation ultimately can manifest itself when the immune system continues to be prodded by some type of irritant. So it may be an environmental toxin, it may be bacteria or virus, it could be due to poor nutrition or how your body is handling stress, what your sleep is like. There could be some sort of reaction that you're having to food that you're eating as well. It's certainly something that's affected by the amount of stress in your life. Could be related just to aging. Your body's not as good at handling the stress as you age.
So is chronic inflammation, is it always manifested in the physical? Like, should I always know if I have chronic inflammation? Is it visible, or is it something I would feel, or how does it manifest itself?
Yeah, I mean, there's no particular way that it tends to be manifesting itself, although it can increase your risk for lots of chronic diseases that are most common in our world today. So this slide, if you do have a moment, I'm not gonna read off sort of all of the illnesses here that are related to chronic inflammation, but I mean, it's covering off big categories like cancer, cardiovascular diseases, metabolic disorders, autoimmune and other inflammatory diseases. There's certainly a lot of aspects of your health that are linked to chronic inflammation. So it's something that really has a universal application, which is part of the reason why I tend to talk about it so often with my patients.
Okay, so when you're with your patients, if they have like a skin rash, that may or may not be inflammation, but there might be other things they don't even know are inflammation?
Yeah, absolutely, right? Inflammation doesn't always manifest itself or cause the same issue over and over again in someone. It could be, in one person it may be triggering migraine headaches. For someone else it may be something related to their joint health. Maybe they have digestive symptoms related to inflammation. So it's a number of different issues. It could look different depending on the person.
Okay, thanks. So prevention of inflammation, I guess that's why we're all here. We don't want it. How can we stop it? How can we reduce it? So yeah, I think you said that there's 4 different points that we can touch upon.
Yeah. So, you know, we had a lecture in February that was related to nutrition and inflammation, and that's an area that I would talk about regularly with my clients, but we've covered that off, so please review the history.
Oh, yeah, you're referring to Nadine Curry, our registered dietitian, who talked about inflammation. It was also really well attended, and that is available on our website.
Great.
Yes, yeah. So thank you for that.
So we don't want to. I don't want to cover off what she's done, and I want to just augment really that topic for her. So areas that I want to touch on are the use of nutritional supplements that could be helping reduce inflammation. There's some techniques on stress management, but also acupuncture, which is something that a naturopathic doctor would use as well.
Nice, great. So I think I've been to you, Ben, and one of the things you recommended I take was fish oil.
Yeah. I mean, that when I think of these 2 supplements that I do want to cover here on this first slide are have a generalized reduction of inflammation in the body. And so something like fish oil, it provides us with omega-3 fatty acids, which when in the body tend to be anti-inflammatory in the way that they act. And so it's something that our body can't make on its own. We have to have it from an external source. So often I spend time talking about with my clients. They say, oh, well, if I'm eating salmon or if I'm having fish regularly, do I need to have an omega-3 supplement? And usually I would recommend for my patients that if they can get a whole food source of a vitamin or a nutrient, then absolutely that's the best way to go. That's the way we are intended to absorb that vitamin or that nutrient. But in this case, I tend to actually prefer the supplement over eating fish.
Really?
And part of that reason is that our oceans are unfortunately, they're not as clean as they should be. There's toxins that do tend to appear in the food chain of animals that inhabit the ocean, and so things like mercury or PCBs could begin to accumulate in the flesh of these sea creatures, and so particularly the fish that we're eating, they're more at the top of the food chain. So your salmon or tuna, those are larger fish, and so they tend to have more of an accumulation of these environmental toxins in them. And so, yes, inherently, if that fish was pure and had no toxins in it whatsoever, it would be a fantastic way to get your omega-3s. But because we have no way of knowing how much is actually in that fish itself, we're exposing ourselves to a risk that isn't fully necessary. So what they actually do for fish oil supplements is Health Canada has standards by which there are certain levels of mercury or PCBs that can appear in a omega-3 fatty acid supplement. And if there are levels that are too high, then they're not able to sell that on the market in Canada. And so they actually source their fish from either sardines, anchovies. Some of them are based from krill, which are all teeny tiny creatures in the ocean who tend to have much less of this toxic buildup that has occurred in them. So in this case, choosing the supplement would be a way to assure that you are exposing yourself to these toxins to a much lesser degree.
Okay. So, but olive oil, it looks like you can take olive oil pure in its pure form.
Yeah, olive oil is interesting, right? It's something that is a food, but I think it's important, and maybe you can just flip a switch in your brain to say, olive oil is so good for me. I want to think of it even like a supplement. And so the things like polyphenol and vitamin E are very anti-inflammatory components that it does contain. And 1 teaspoon a day of cold press.
Oh, sorry. Sorry, I put tablespoon there. So is tablespoon too much?
Yeah, no, tablespoon. Sorry,
Okay.
my eyes must have read teaspoon there. 1 tablespoon, and of the cold pressed room temperature olive oil is important. And that room temperature piece is important because often people will say, well, I'm using olive oil in my sautéing. Isn't that a healthy way to prepare some foods? Well, without getting down too much of a rabbit trail, as we heat cooking oils, what can happen is they tend to begin to alter their form under that stress of the heat.
Okay.
So each oil has a different smoke point, and if it reaches that temperature, then it begins to become harmful instead of positive in terms of the health benefits it provides. So room temperature for olive oil, a tablespoon per day. Maybe you can add it in a smoothie. You can just swallow it down if you'd like as well. It could be something.
What about in your salad? That's okay?
Yeah, you can have it in your salad or dip with bread. So those things will be great ways to take it.
Nice. And then vitamin D, that's often when people ask about a lot. That's been covered in the media a lot. You're taking your vitamin D supplements. So this is something that you also recommend?
Yeah, vitamin D is having its day in the sun. Pardon the pun.
Oh boy.
And essentially, rightly so. Vitamin D has a lot of health issues. Specifically, I do want to talk about, kind of zero in on its way that it can help support your immune system when it comes to cold prevention, flus, that sort of thing. And so, since we live in Canada, essentially the studies show that if you live north of Atlanta, Georgia, the sun is just not strong enough throughout the majority of the year for us to actually to allow our skin to be able to convert the vitamin D into the active form. And so supplementing that is something that's important. And so most health practitioners are recommending about 2,000 IU, that's international units per day, and I think that makes very much good sense. So research is showing that vitamin D can help improve your innate immunity, and it can decrease the incidence that someone has of cold and flu. So it's just from an immune system, inflammatory perspective, spot on.
All right, but the summer's coming up, for people who like to canoe or sail or just plan to be outside, is it really necessary to take a supplement in the summer?
Yeah, for me, sometimes taking supplements comes down to compliance, right? So if you, if you're someone who's pretty regimented and you know that from, let's say, I recommend from Thanksgiving to Easter, basically, will be the time of year that you definitely need to supplement. But if you're someone who takes care of your skin in the summer and you're using sunblock regularly, the sunblock actually blocks the ability of your
Oh,
skin
really?
to create
Okay.
vitamin D. And so you could continue to supplement in the summer, or what you could also do is for about the first 15 minutes of time that you spend in the sun, you could do that with uncovered, don't use sunscreen, just let your natural skin absorb the sunlight for about that 15 minutes, which would be enough to start to create a positive amount of vitamin D in your skin. And then after that, make sure you head in and get your sunscreen on and make sure you're keeping your skin safe after that. So to answer your question, Tanya, you could, you don't necessarily need to supplement in the summer, but it may just be easier for some people. Put your sunscreen on before you go out, take your vitamin D supplement, and you know you got both bases covered.
Yeah, that does sound easier. Thank you. All right, so it looks like the next supplementation is regarding IBS, digestion, and inflammation. So yeah, what do we have here?
Yeah, so irritable bowel syndrome, or IBS, is just sort of it's like a constellation or like a group of symptoms that people can have related to their diet. So maybe it may look like someone having constipation, diarrhea, gas, bloating, some type of abdominal discomfort or pain, and studies vary on what percentage of the population they believe are actually affected by irritable bowel syndrome, but it's kind of coming in around between 10 and 20%. So it is quite common,
Right.
which is why I wanted to keep these ideas broad, and I know lots of people are having digestive issues, and so it's good to think of some ways they can combat digestive inflammation. So the herb aloe vera, it's a wonderful plant, but in the form of either a supplement or those aloe vera drinks that you can purchase at convenience stores. Aloe vera has been known to be able to benefit constipation and abdominal discomfort and gas. So that might be sort of an easy supplement to take. Another one that I like to recommend, and what I should actually say, Tanya, I know you alluded to it at the start where you said that this advice isn't intended to diagnose or treat or anything of that nature, and I think that's important to keep in mind is that for all of you who've signed on, I don't know your health history. I don't know if you're on any certain types of medications, right? And so these recommendations, although helpful in the general public, they may not actually be right for you. And if you are experiencing any of these issues, or you're looking for a more personalized approach to inflammation, then Medcan can be a great resource in terms of helping you work with that. Whether it be seeing someone like myself or one of our other naturopathic doctors, that might be something that is warranted, because ultimately we want to make sure that what's being recommended is right for you and safe for you.
Right. I mean, I read about kombucha and probiotics, and then I buy kombucha and probiotics, but I don't always know if it's the right technique. And now I'm tempted to get some peppermint oil and some psyllium fiber. So, yeah. So I've actually never heard of peppermint oil. What in capsule form?
Yeah. So peppermint oil, it's fairly strong, and so it's encapsulated usually in gel caps. And so it doesn't get broken down until it reaches your stomach. But ultimately what it does is quite a number of things. It can help reduce the amount of gastric motility. Sometimes people's digestive systems are just overactive, and could be leading to more inflammation or diarrhea. And so in reducing the gastric motility, that's something that they would want to keep in mind. It's also known as something called a carminative, and a carminative is a Latin medical term just for something that soothes the digestive system. So it's just meant to reduce inflammation, calm everything down, and it's very helpful in that form. Psyllium fiber is another form of fiber that can help if you're dealing with either constipation or diarrhea, and certainly sometimes thinking of fiber as a supplement is beneficial too, because sometimes it can be hard to get that recommended 25 grams of fiber in a day just because our lives are on the go, we're busy. So this way it just gives you good peace of mind that you've reached an adequacy in terms of the amount of fiber that you need, but also it could be providing direct benefit to some of these digestive symptoms if you're dealing with them.
All right, well, we're getting some questions, so let's move on to the next slide, and then we'll get to our question period shortly. So the next one is on joint health and inflammation.
Yeah, so I mean, this is something that tends to be an issue for a lot of folks as they age. Our joints, can tend to be dealing with inflammation regularly, and so there are studies that are showing promise with the supplement turmeric. The active ingredient in the turmeric is something called curcumin. And it could be a spice that if you use it in your cooking, I mean, that's fine. You could get some health benefit, but what's important is that in these studies, they actually are studying a very specific dose of this active ingredient. And so if you're having that as a spice in some foods that you're cooking, you may not be getting a high enough dose to get yourself into that range of dosage where you're getting the benefit from it, right? So in supplement form, it may actually help you, get to that intended dosage range. Something else that's kind of come onto the radar in terms of joint health is something called new egg membrane. And so if you've ever had a hard-boiled egg, you peel back the shell, and then before you get to the egg itself, there's almost like this layer of skin. So I don't know, I kind of call it egg skin. And they're beginning to, science is beginning to research its benefit. Part of the reason is that North Americans are buying more and more egg whites, and so they're already breaking the egg down, and they're like, well, how can we use these other egg parts? We're using the egg white, how do we use the other egg parts? So they've been studying this egg membrane, and they found that there's this benefit for lots of different joints in our body, showing that it helps with cartilage and connective tissue support. There's a number of active ingredients that they're looking at. Glycosaminoglycans and hyaluronic acid are sort of top of mind. And it's a fairly safe supplement at this point, unless you have an allergy to eggs. It's usually very well tolerated by most people.
Yeah, I had never heard of that. But when you were talking about turmeric, I was thinking that I'd heard that in order to absorb the turmeric, you should eat pepper with it, I guess, when you're cooking. So are there certain supplements that you should have with foods or you should avoid with foods when you're taking supplements? Yeah,
I mean, there are a number of foods that have those sort of connections where they help they can help each other out. A lot of products, when you buy them, there's some dosage instructions on the bottle or the packaging, and usually those take into account if that supplement should be eaten away from food, if it should be taken with food, if it should be taken in the morning, at nighttime, those types of things. They're already taking into account to sort of optimize your body's ability to absorb those. So if any of these supplements you ultimately end up using, or if you're using any others, please take heed of what's sort of on the packaging, because it's designed to make sure that you're optimizing that type of absorption.
Sure. Right, and another reason to work with a professional. All right, so now you're talking about fibromyalgia, and that's, it's a very hard condition when you're constantly in pain with all your ligaments and your muscles and your tendons. So how can supplementation help with that condition?
Yeah, I mean, this is a really good example of a more kind of chronic and ongoing inflammatory condition, right? It's something that seems to be becoming more prevalent these days as well. And so there's a couple of herbal medicines that can be helpful for it. Rosemary, which is another spice that we use, but it's known as Rosemary officinalis. It can help reduce a inflammatory marker that is associated with fibromyalgia, as well as pain scores in terms of suffering of fibromyalgia patients. And so in this case, it's taken as rosemary oil, and so that's something to keep in mind. Rhodiola is another herb. It tends to be anti-inflammatory. It's an antioxidant. It can help with pain relief. The classification of the main action of rhodiola is known as an adaptogenic herb, and so An adaptogenic herb is something that helps your body adapt under stressful situations, and so it helps your body deal with chronic stress in a more improved fashion. And so rhodiola in this case would then be indicated to help support fibromyalgia.
All right, so you've touched upon how we can help our bodies deal with stress through supplementation, and but you mentioned that you're going to talk about stress management and what we can do behaviorally, or is that with your mind, or how you structure your life? What do you mean?
Yeah. So before I get onto that, Tanya, I should say that you know, I know that for me, when it comes to nutritional supplementation, often a less is more is an approach that I take, right? So I want to make sure that whatever treatment that I'm giving to a patient is something that's as sustainable as possible, right? And so even if I'm using natural supplements, but there's a whole lot of them, it just becomes very cumbersome, and then that patient is becoming overly reliant on these supplements to improve these health conditions. So if there's ways that I can help through more sustainable measures, like managing stress better, cue this slide, of course, would be a way that I always want to make sure that I'm taking all approaches that are within my scope of practice to be able to make that treatment be as sustainable as possible. So getting on to specifically the stress management piece, this is a little picture from a research study where they showed people that were applying a deep breathing meditative technique into their lifestyle. So that may be something that is done in the form of joining a yoga class, and maybe something where you have taken a course called mindfulness behavior stress reduction, so a mindfulness course. But essentially it's about applying this deep breathing meditative technique, and they found that it helps reduce inflammatory markers, it helps increase immune cells that are within your immune system, and then it actually can help increase something called telomerase activity, and so that is related to basically anti-aging. So you know that applying those deep breathing techniques and you get a direct benefit. It's actually a very wonderful thing, and I talk about it with a lot of clients.
Well, just you mentioning that, I was focusing more on my breath. So I guess doing that a little bit more frequently throughout your day, closing the door, turning off your phone, and just spending 10 minutes at your desk uninterrupted and just practicing breathing would be a good way to start.
Yeah, I mean, usually I recommend clients, if at all possible, to go to a yoga class first. And part of that is that it's on your schedule, right? There's a specific class at a specific time. You know, you may get to know the teacher or other participants in the class, and it becomes almost like a place where you belong, right? And part of that is just to be able to have a positive experience where you're really focusing on that deep meditative breathing. And at the end of that hour of that intentional time, chances are you're going to feel a lot better. And then that feedback, after you've gone to classes for a while, you begin to want more of it. And that's where, you know, implementing it in, you know, being able to close the door to your office and doing it for a short period of time, even as little as 5 minutes, can make a big difference. Or whether it's something you're doing at home in your own time, because you've already had that experience in the yoga class, you know that there's benefit to applying it in those settings as well.
Yeah, I'm beginning to see the value in, you know, long walks in nature, or even the sitting in the sauna for 5-10 minutes. So
absolutely, yeah, it could look
doctor's orders.
Yeah, absolutely, yeah, it could look different for different folks, you know, whether it's a walk or anything of that nature. You're
okay.
Right,
well, for a lot of people, acupuncture seems like a really you know, far off type of treatment, but it's becoming a lot more mainstream. It's an ancient form of Chinese medicine, but it's a lot more mainstream. A lot of insurance covers it now, and you recommend it. Why is that?
Yeah, you know, acupuncture, you know, a lot of people are using it now for pain management or part of physiotherapy and sort of recovery after an injury, that sort of thing, and that's I think how one of the ways it's become more popular. But you know, the way that I apply it in my practice is within the context of traditional Chinese medicine, right? And so, they have theories around energy or chi and yin and yang and balancing different systems in your body. And so, I mean, what I love about it is it's this real blend of art and science. It's very well researched, right? So I can apply protocols that have showed benefit in these areas, and I know that it's something that is going to provide the benefit that is stated there. And so it's something I use very regularly in my practice.
But you don't do it yourself?
No, I actually do.
Oh,
yeah.
you do?
Yeah,
Oh,
so
wow.
we do it right here in my office at Medcan. It's all equipped to do all that. I mean, we use one-time use surgical grade
All right.
acupuncture needles for every treatment. It's very safe and effective treatment. So, I mean, there are benefits in terms of allergic rhinitis, which essentially is seasonal allergies, right? It can be there's benefits, studies showing it helps with autoimmune disorders or nervous system regulation. There are different people who have immunodeficiency disorders, and it can help them with pain management or tissue healing and things like that. So it's a very well applied treatment.
All right, well, thank you so much. Now, we do have quite a few questions, and so we will get to our Q&A right now. I'm just going to give Ben the chance to review some of those. In the meantime, I'm going to take a few moments to describe naturopathy here at Medcan. Sorry about that. Let me go back. There we go. So as Ben has suggested, our naturopathic philosophy at Medcan is that of stimulating the healing power of our bodies through diet, exercise, and other therapies to help treat the underlying cause of disease or prevent disease. And our practitioners will collaborate with your physician to provide a well-rounded view of your health. And this can complement other healthcare strategies that you're already working with, and it can deal with so many different conditions as we've discussed today: pain management, frequent colds or illnesses, skin disorders, digestive issues, stress management, seasonal allergies, chronic headaches, and so on. So if you have any questions or you'd like to learn more, please visit medcan.com, and you can speak to our naturopathy coordinator at the number on your screen, 416-350-5956, or by email at naturopathy@medcan.com. All right, so we're going to move on to some of the questions. The slides are available. They will be made available in a YouTube video that will be posted on our website in around just under 2 weeks. So feel free to check medcan.com in a few weeks, and the recap of this seminar will be made available. So we have some specific questions. One is about coconut oil, and so you mentioned peppermint oil. Is coconut oil good for you?
Yeah, so I mean, that's interesting. Coconut oil has definitely sort of been on the rise in its use, and it may have been something that I could have included on that first initial slide with the fish oil and the olive oil. You know, I think it's part of the reason why the fish oil and olive oil got on the slide is that they've just been around a little longer, and there's a broader depth of research into their applicability. But I think, you know, the elements in coconut oil can also lead toward anti-inflammation, and that would be something that would, you know, make sense to be able to use. Again, with coconut oil, if you're using it to help saute or you're heating it up, we're getting into that same issue around reaching a smoke point and you negating the benefits in it. So you would want to be consuming it, you know, either gently warmed, because I know at room temperature it can be sort of in more of a butter or like a paste, right? So, you know, you can gently warm it to consume it as an oil. It can be something that goes easily into a smoothie as well.
All right, thank you. Now, what about certain naturopath supplementations, like certain probiotics and enterococcus? I'm not sure about that. What happens if they're not available in Canada, but they're available in Europe, and so people are buying these products from, one person is buying them from Austria? Yeah,
I mean, technically, I mean, a lot of these health supplements or things like probiotics, it is driven by the open market, right? And so there are some products that are available in the States or Europe that may not be available in Canada. And with something like a probiotic, you know, there may be a specific strain of probiotic that maybe a company has patented its use of it, and if they were European-based, then it would be fine to have that shipped to Canada and to consume it. Some probiotics require being refrigerated in order to keep the bacteria actually alive and viable. But more and more so, I think researchers and businesses are looking to find more stable forms of probiotics that can actually be stored at room temperature. So that might be something if you are planning on purchasing a probiotic bacteria from a place in Europe, just getting a sense of, is it stable at room temperature or does it require refrigeration? Because the speed at which it's delivered, if it did require refrigeration, it may not stay cool enough, and you may be losing some of the effectiveness of the product in that delivery
and
time.
then also, we don't know if it meets the standards of Canadian guidelines.
Yeah, I mean, Health Canada is a great resource, and they're very conservative. So they want to make sure the public is safe. That's first and foremost, right? And so, but when it comes to something like a nutritional supplements, like a probiotic, there generally could be safety. And I mean, and it might be worthwhile, connecting with a naturopath in a more formal setting. Maybe they actually are available in Canada, but they may not be available to the public. They may be through professionals only. So there are supplements that are marketed directly to physicians and naturopaths and chiropractors that may not be available to the regular public. So maybe what you're looking for may actually be available in Canada. So that's another way to look at it.
Great, thank you. So another question. I've been told by a naturopath that I have a leaky gut. Does this have anything to do with inflammation? And if so, how can I go about repairing it?
Yeah, specifically the leaky gut is something that the belief is that our digestive system is like a fortress wall, right? It's only meant to let in certain things that we need, certain nutrients that we need. And if there's inflammation that's occurring on a regular basis in your digestive system, what it can do is it can sort of begin to break down parts of the wall so that molecules that were never intended to enter our bloodstream can actually just pass through into the bloodstream in a very easy way. Once those molecules get into the bloodstream, then our immune system's like, that's a problem, that should not be here, and it can really cause a reaction. And so leaky gut is something that, it's a term where it's hard for medical science to define what it really is. I mean, but how I view it is that if you are undergoing sort of chronic digestive symptoms, chances are you may be creating an environment in your digestive system where it's not working optimally, or there may be things that can cross out of the gut and into the bloodstream and then cause even further problems. So, leaky gut is something that, or dealing with chronic inflammation when it's related to someone's digestion is something that I work very regularly with clients on. And it's a bit of a process to get through it. So it may take, 3 months or more to actually start sort of really reducing that inflammation and allowing the tissues in your gut to actually heal up and kind of re-strengthen so that barrier is fortified again.
Yeah, that was my question. Are you able to repair the wall?
Yeah, so ultimately, yes. I mean, your gut is one of the fastest reproducing tissues in your body. It's always sort of regenerating itself, but certainly any help that we can give it to heal in a state where there isn't inflammation happening all the time is much better for the gut.
Nice. All right, so last two questions. What is your recommendation for dosage with turmeric? And then what do you think of barley life? And that's kelp, barley leaves, and a gel pill.
Yeah, so I think for the turmeric, it's about 2.5 milligrams per day, which is about a teaspoon, right? So, I mean, you think if you were using it in cooking, you might use a teaspoon in your entire recipe, right? So you're not going to get that full dose. Whereas if you're taking it in supplement form, it'll have it, have that capsule, whether it's 1 or 2 capsules, it'll have that sort of regimented amount for you, and sometimes it's just easier because eating a dry powder spice like that might be something that's difficult, or maybe you're mixing it into a little bit of water, and even that could be a little bit difficult. to consume. So essentially, a lot of times for me, I just want to make sure my clients are able to get these healthful things into their life as easy as possible. So sometimes in a supplement form, it just makes it easier than to make these little elixirs of turmeric in your water and your olive oil and coconut oil.
Yeah, and all the mess,
And the mess, yeah.
And then what about Barley Life? That's the one with kelp, and have you heard of that?
Yeah,
supplement?
Unfortunately I haven't, right? I mean, it's something that I'm working diligently to sort of stay on top of, the amount of supplements and what's out there, but there's a lot of products out there in the natural health field. So I unfortunately don't have any experience with that one. But if there's, I could certainly look into it. I don't know if you, whoever asked that question, if they're able to email naturopathy@medcan.com. Maybe I could do a little more digging for you.
All right. Well, that's very generous of you. Thank you so much, Dr. Klinck, and thank you to everyone who joined us today. Again, this recording will be made available in a few weeks on medcan.com under the recap. And thank you very much, and hope you have a wonderful evening.
Thanks so much.
Bye-bye.
Bye.